Thank you very much, and welcome everyone, and good morning to the workshop on the roundtable on obesity solutions. My name is Pronk. I'm president of the Health Partners Institute and chief science officer for Health Partners in Minneapolis, Minnesota, and a member of the Food and Nutrition Board, as well as serve as the chair for the roundtable on obesity solutions. The roundtable is the group that is actually sponsoring this workshop today. The roundtable was established by the Health and Medicine Division, formerly the Institute of Medicine, already about 7.5 years ago. The idea is for us as a roundtable to engage leaders from diverse sectors and voices needed to solve our nation's obesity crisis, including health, healthcare, industry, government, philanthropy, not-for-profits, the financial sector, as well as academia. Through discussions and public workshops like this one, publications, as well as our 4 innovation collaboratives, the roundtable fosters an ongoing dialogue on critical and emerging issues in obesity prevention, treatment, and weight maintenance. Utilizing a policy, systems, and environmental change lens, and a focus on effective equity strategies to address obesity-related disparities, the roundtable explores and advances effective solutions. So it's our pleasure to welcome you today to our second workshop in this series in 2021. To set a little bit of context for today's workshop, Meredith, if we can start the slides, that'd be terrific. Obesity, as you know, has shown itself to be quite an intractable condition. Prevalence has steadily increased over the past 5 or 6 decades and indicates that prevention and treatment approaches probably need some change. In an effort to chart a new course in addressing obesity, the roundtable itself in 2020 spent an entire year on strategic planning. We took a systems-oriented approach to identify priority areas for obesity solutions that culminated in a systems map of drivers as well as evidence-based solutions to obesity. The map was used to determine the cross-cutting priority areas that the roundtable would pursue over the next 3 to 6 years. As a roundtable, including focused efforts with our members, we held group model building exercise sessions. We held member webinars throughout the course of 2020 to gather input and feedback on systems approaches. And we disseminated new ideas regarding systems perspectives and applications to shift the mental models through these meetings, workshops, as well as publications. As a result, we ended up with a systems map that really, as developed by our roundtable members, included both the causal factors that drive obesity, as well as the obesity solutions that have enough evidence to act. Following a round of priority setting and making sure that we get input from as many stakeholders as possible, we identified 3 priority areas of focus. 1, structural racism and social justice. Secondly, biased mental models, stigma, as well as effective health communications. If we go to the next slide. So 2021, as a follow-up year after this year of strategic planning, introduced once again a workshop series with a first workshop focusing in on the structural drivers, those 3 areas of focus, if you will, that influence obesity solutions. Today, we're going to explore further strategies for leveraging communications, as well as examples of data-informed approaches in different settings. And the goal today is to explore data-driven solutions and innovative approaches that leverage the relationship between these 3 priority areas as drivers of obesity, as well as identify systems change applications and actions for the future. Later in the year, in October, our 3rd workshop will start to consider opportunities for sustainable systems-level changes to build back better. The workshop proceedings will come in towards the end of the year, with the final report summarizing all 3 workshops in early 2022. Next slide, please. This slide shows the map that the roundtable came up with. Obviously, as it's not intended for in-depth discussion today, the idea is here to show you that the map presents a series of deep leverage points, if you will, that have an impact on the system as a whole. The way that this map is organized is that in the middle you can kind of see the causal factors that the roundtable focused in on, and they are shaded a little like mostly in brown kind of color. On the outside, you see more of the solutions, the evidence-based solutions, and the priority areas are highlighted in a light blue. The first section are these structural racism and social justice areas towards the middle. Biased social norms and biased mental models is located in the middle, and effective health communications is located in the middle. If you go to the next slide, Meredith. The way that these areas of focus were picked was by intentionally looking at different levels of the framework of the system that are outlined in Meadows' framework as having a deep impact on how the system actually behaves. So deep leverage points towards the bottom of this framework are representative of goals of a system, the paradigms out of which systems arises, and the variables that have power to transcend paradigms. These kinds of deep leverage points in a system have real opportunity to change the system as a whole. Unfortunately, they are also the most difficult to affect. Yet these are the areas of focus that the Roundtable has decided to focus in on as the first three priority areas. There are other areas of focus. As you can tell, these on the map, these brown and blue areas of focus extend beyond the first three areas of priority. But these three areas of priority allow us to organize around major factors and deep leverage points in how the system behaves. And therefore, these represent the areas of priority for the next couple of years. Next slide, please. The way we're going about that is to recognize that these three priority areas will be central to the work of the Roundtable. So the Roundtable activities will interact with these three areas. They will also show up in our innovation collaboratives work and will be addressed by workgroup activities that are more ad hoc. But because of just because there is a priority focus, there is other work that goes on as well. So interaction and feedback among these different areas of activity allow us to continuously move forward and hopefully we'll be able to address in a meaningful way these three different areas of priority over the next couple of years. Next slide, please. So with that, today's workshop is focused on introducing the health communications topic and also to provide examples of data-driven approaches towards solutions that are scalable and sustainable and address systems level issues. So session one in today's workshop will be focusing in on operationalizing health communications for obesity solutions. Session two will provide several examples of data-driven obesity solutions and innovative approaches. And we've picked two settings for that purpose, one the healthcare setting and another in the school-based setting. Session three will provide an introduction to innovative policy solutions. And then finally in session four, we will reflect on the day as a whole, and our keynote will be followed with a speaker panel for discussion and question and answer sessions. So I think today you will find that we have a series of presenters that are second to none. We're really excited to be joined by this group of speakers and the approaches that they will present in their presentations. With that, I would like to go to the last slide of my session here and really express my thanks and gratitude to the planning committee, as well as the staff. Let's not forget the staff. I'm joined by my co-chair, Angela Adams-Young from the University of Illinois at Chicago. We have Dr. Carol Bredbenner from Rutgers University, Carlos Crespo from Portland State University School of Public Health, Stephanie Navarro Silveira, Montclair State University, and Melissa Simon from Feinberg School of Medicine at Northwestern University. So I really appreciate the planning committee for their hard work. Their full bios are available on the Roundtable website.